Hi everyone, welcome to Get Well with Dr. Shel. I am Dr. Drshelenalaljiaesthetics, better known as Dr. Shel, and I know as a board-certified OBGYN and a functional medicine expert, your health is unique and deeply personal. It is a combination of genetics, lifestyle, and environment. Know this, no matter what your starting point is, you are never powerless over your health. Being on a health journey is a marathon, not a sprint. This podcast is about walking you through many different perspectives on health conditions, symptoms, and solutions that can help you get from fatigued to fabulous. My mission has always been to offer my patients and community the best of mental, physical, and spiritual wellness. You can learn more about me and my wellness center and schedule your telehealth appointment at drshel.com. We can support you no matter where you are in the world. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin. Welcome, everybody. We are so thrilled that you're here for my Get Well with Dr. Shel podcast. I am super excited about today's guest, Dr. Medea Saeed, AKA Holistic Mom MD. I just love that title. That's amazing. And to have a chance to speak to her about the challenges of self-care, which is so pertinent right now, boosting mom's immunity, because, you know, all of us moms, we know that we come last on the list, even though we shouldn't, and also about her latest best-selling book. Now, and since so many of our community members work with women and moms, we are sharing this with our tribe, who we love. So please pass it on. Dr. Medea is a board-certified family physician, best-selling author of The Holistic RX, Your Guide to Healing Chronic Inflammation and Disease, and now Adam's Healing Adventures, which was shared in Dr. Mark Hyman's newsletters as one of his, there it is, it's awesome, great, great book. I can't wait to talk about it. It was one of his favorite picks. She's also the founder of the Family Health Expo. She's the director of education of Documenting Hope on Wellness Mamas and Mommypotamus, I love that, Medical Advisory Board, regularly contributes for holistic primary care, and has appeared on international TV, radio, and print media. How do you do it all with having 4 kids, Dr. Saeed? Dr. Saeed and her 4 children speak internationally, igniting the world with passion and energy to create a healing revolution. Welcome, Dr. Medea. Look at you.
Thank you.
You're amazing.
Thank you. I'm so blessed to be here. So thank you so much.
Yes. Oh my gosh. So happy to have you here. So I want to kind of talk about your story. But before we start talking about that, what brought you, because, you know, we're all physicians and we probably all started off in traditional medicine, right? As our, you know, we have hundreds of thousands of physicians out there and they're practicing traditional medicine as we did. And we all have a story about what brought us into functional medicine after being a successful MD. So what is your story?
Oh my gosh. Yes. Quite a story it is. Thank you.
And we'd love to hear it.
Gosh, it is exciting.
Yes.
But it all started off, you know, I was born and raised in Naperville, Illinois. I've been here all my life. And, you know, I was raised on the same lifestyle that most of us have been raised on, that have led most of these adults and children down the road to chronic illnesses.
Yes.
And that it was, you know, taking popsicles, you know, pop to school every day and cereal. My mom literally loved it, even though like she was from Pakistan originally, and so food was love. But we grew up on junk food because that's what made us happy. So she wanted to keep us happy. So the entire basement was filled with the cereals from couponing, you know. So
Yes.
That's what we did. But
it's the SAD diet, right? It's the standard American diet.
Very sad. Exactly. Very sad.
Yes.
And, but it sort of started creeping up on me. You know, I had started having a lot of chronic issues as a child, acne, eczema, my hair started falling out. But it never really really came to a head until residency. So residency, I was a new mom. I was a new wife.
Wow.
And a new resident. So me and my husband were both interns.
Wow.
Working 80-hour work weeks.
Oh yeah, it's no longer like that. Like I remember it as an OB-GYN intern, I think I worked 111 hours per week. That's even insane.
It's insane.
So obviously your stress level was out the roof.
And then we had free food at the cafeteria.
Oh, go for it. That's anything that's free in residency, you go for, right?
You go for it. You're not sleeping. You're not eating well. You're stressed beyond belief.
That's right.
And I just got married. I mean, we're newly married to somebody who was born and raised in, a different country than I was.
Wow.
All different expectations. And so we were both like oil and water. And now you have a new baby.
Wow. So all that hormonal stuff is going on too. There. Yeah.
And I was diagnosed with, within my pregnancy, I was diagnosed with Hashimoto's. And then, but right afterwards, especially as these things started to accumulate up,
right,
joints started hurting, rashes got worse, shingles.
Yeah, for sure.
My entire body was literally falling apart. Wow. And then I was diagnosed with lupus. And so, again, as a busy mom, I just continued on that hamster wheel, right? Sure. Just trying to stay above water.
Survival mode.
Survival mode. Obviously, and then it was really a huge blessing that there was a daycare right across the street. So when I was on OB call, I can go across because there's still a hospital campus. I can go in and I can just check out my baby. I can nurse him. But one day I walked into the nursery. And they were about to suffocate my child. Like she was basically, I walked in and he was muzzled down into blankets. I know. 2 receiving blankets with pacifier in his mouth and another Winnie the Pooh blanket wrapped around his head really tightly.
Oh no.
So he couldn't breathe. His eyes were bloodshot. I picked him up immediately and I'm like, what are you doing? You could have killed my child.
Yes.
And he ran out.
Yeah.
At that time, the universe saved my child. And I vowed and I made a commitment at that time that I will take care of this child the best that I know how.
Sure.
But then how am I supposed to take care of this child the best that I know how if I myself was falling apart?
Of course. I mean, and what a good point that you make, because, we've all gone through our own journeys and our own stories. And as a gynecologist, I've practiced for over 20 years and I tell my patients, and I talk about it in the book that I wrote, I Am Woman, Our Journeys to Health, Happiness, and Harmony. And the first thing I talk about is, as women, we just have this, it's a cultural gender thought process that's passed down the generations that we can be super mom, super wife, super worker, super everything. And it doesn't matter what toll it takes on us because we just need to be here to serve everyone else. What we're not really realizing is that oxygen mask theory, right? I mean, if we don't have the oxygen mask on ourselves first, we're not going to be around to put the oxygen mask on our child or on our spouse or our patients or anybody else. And these are tough lessons, and I think the universe keeps teaching you these lessons until you finally learn it, right?
Finally learn it. And I was exhausted.
You were exhausted. Yes.
I was giving and giving and giving.
Yes.
Trying to keep everybody else happy around me besides concentrating on filling my own vessel.
Exactly.
And that's when I broke. I almost broke. And so really then I dived into integrated, because actually right after residency, I joined this medical practice where under one roof there was me, an OBGYN, an internist, an exercise physiologist, nutritionist, counseling, chiropractor, massage therapy.
Whoa.
All brought together for the
amazing.
Yes, I know.
Amazing. That's what we all need everywhere, right?
Absolutely. And that's when it opened my eyes to this entire world of functional, holistic, integrative medicine.
Yes.
And since then I've never gone back. And now we live it, breathe it, preach it. Like it's literally flowing through every cell of my body.
It's in your blood. Yes. So that's an awesome story. And truly, I can relate to that story 110%, because we've all gone through our journeys. Mine was going from an OB-GYN and, after my second child was born, as a mom, I knew something was wrong. As a woman, I knew something was wrong. But when I went to my OB-GYN, I was told it's just postpartum depression. And, here's a sleeping pill, here's an antidepressant, and see you later. And that's when I decided, much like you, that because we have the education and the expertise, we also have the responsibility and honor to pass along this knowledge to millions of others.
Absolutely.
And that's when my functional medicine journey began. And much like you, my belief is in this holistic approach, because without it, you really can't guide your patients well, you know?
There's no way.
And yeah, I mean, we can preach this, take care of yourself, put yourself first, da 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 da. But we oftentimes, and let's be honest and let's be real, we sometimes don't follow our own advice. As you know, my husband was diagnosed with ALS in 2017. And there was absolutely no self-care for an entire 2 years. There was a sprint, not a marathon, for 2 years. And guess what happened 2 years later? I got diagnosed with breast cancer. And does anybody doubt that had a lot to do with lack of sleep, lack of nutrition, lack of exercise, lack of self-care, and the excessive amount of stress? So coming back to like your story of, you had this, realization because of a personal experience, and that's when it really becomes your mission. So your mission became to be the holistic mom.
Absolutely, because again, just like you and your situation, I mean, my body was suffering also, and I didn't recognize it until your body's like, "Hello,
wake up call, wake up call, woo, come on, wake up." Yes, yeah, absolutely. It has to speak loud and clear for us to realize it, and it shouldn't be that way, but it is.
It should not.
Yeah.
And I think it was like either culture or what we grew up with. I know I saw my mom sacrifice everything for us children. Yes. And I mean, I don't think self-care, I never really saw self-care. I think I truly be honest, my mom is still, there's still limited self-care there. I'm still trying to educate her.
Right.
Because it was all family first all the time.
Right.
But when I entered into this world, I'm like, my body is obviously trying to kill itself. With lupus, your body is trying to kill every cell of the organ, every cell of your body.
That's what happens.
That's what happens. And so I knew that was a wake-up call, that I needed to put myself back into balance. But when now you have all of these different platforms, I'm speaking, I'm talking, I'm right now I was a new mom, a new wife, a new resident, and now with all these other responsibilities, it's very difficult to figure that out, because and that's when I started my Holistic Mom MD, because I'm like, I made it a journey.
Yes.
This is how I am going to live my life. I'm going to take all of the evidence-based science out there. Yeah. And I'm going to try to see how I can implement it in my life. And then I wanted to then, show everybody the journey that I went through.
Correct.
And so currently right now, I have all this other stuff going on, but I feed a family of 8 every day.
8.
Yes, because we're in a traditional family culture where my in-laws live with me.
So yeah, I relate. Mine lived with me for 20 years, 20 plus years.
Oh wow! So exactly. So you got so much in common.
Yeah. Like-minded. We're sisters of the heart.
Absolutely.
Do you see the invisible halo on both of our heads? Do you see? Yeah. No, honestly, it was an honor and a privilege. It really was. My mother-in-law was an amazing, amazing woman. We lost her a few years ago, and she taught me so much. And she was, such a great grandmother for my kids. And it's just.
And that's what I'm noticing too. But then with all of that, then there's extra responsibility, right?
Of course.
And so now and then the weekends I can go to 20 people, because my husband's the oldest and they're all show up at my house. Oh. So I wanted to show people that it can be done easy, fast, cost effective. Yeah. It's all science-based, and these basic principles of your everyday lifestyle. Right. That if we can incorporate that into our daily routine, we can keep our immune systems as optimized as possible. Perfect. And then, because if we role model this good behavior, we can also do it with our children.
Absolutely. And I'm so glad that you pointed out all of those healthy habits, all of the, clean cooking, clean eating, clean lifestyle really promotes our immune system. So let's talk about the immune system for a minute, because right now, in today's day and age, it's on everybody's mind for obvious reasons. We are in a pandemic, and this is what is going to protect us. Over 200,000 people have died in this country, and we're so devastated about all of this. We need to protect ourselves, each other, our patients, our kids, our families. So let's talk about that. What is it that you can do despite being a super busy mama, right? Super busy mama, and this should apply to super busy dads, super busy people. What can we do to optimize the immune system and overall health and well-being despite our busyness?
Oh, absolutely. And this needs to, again, take front and center stage.
Yes.
Because remember, the immune system is what protects us. Otherwise, we would not be in a great situation.
No.
And it really helps heals us. But
Mm-hmm.
only, and this is the key, only when we take care of it will it take care of us.
Yes, exactly.
Because when we start to destroy it, I know specifically right now during this time of fear and stress, they're all talking about, like, you know, gaining 15 pounds and you can eat what you want. So when we're destroying our bodies with artificial foods like processed foods and starch and sugar, and there's increased stress and lack of sleep and negativity, and then increased toxic exposure, that can all lead to an immune system that's not functioning appropriately.
Exactly.
And so it all really starts with our lifestyle. Because right now, specifically with this virus, we know that those people that are suffering from these comorbidities and mortalities are those with chronic health conditions, obesity and heart disease and hypertension and diabetes and old age. And 88% of the American population is metabolically unhealthy or pre-inflamed. So this is ridiculous. So we can use this time instead. Instead of grabbing the comfort food, we need to use this time as a time to empowering us from within.
Absolutely.
So the simple things that we can do on an everyday, ongoing basis can really help to optimize our immune system and make it functional. Because I mean, the immune system is constantly rejuvenating itself.
Yes. Well, you know, and our cells will only regenerate when we are sleeping well. So, you know, sleep becomes a really important part of this because we're not going to regenerate our cells, like you said, unless you're sleeping. And if you're not regenerating your cells, you're not repairing your cells, and you're not
restoring yourself.
Not restoring yourself, exactly. And you know, I agree with you when you say this whole pandemic has kind of put us into this, well, I'm just so upset and so negative and so fearful and so all that, so I deserve to eat donuts or junk food or, you know, gain the 15 pounds I'm allowed. And what we're not thinking about is this is precisely the time that you actually want to take the best care of yourself, because this is when our bodies need it the most. Because yes, this virus is so prevalent right now, and you know, thank God we're trying to do everything we can to protect ourselves, but your immune system is a personal system that you have, you know, the armor that you have to strengthen with your healthy eating and your exercise and your meditation and your yoga and your sleep and decreasing that stress, right? All of that falls under the lifestyle.
All of that does, it falls under that, you know, category, because what happens is that we need to understand that we have more control over our immune system than we ever thought before. It's really adaptable. It's responsive to how we treat it. So if we treat it with respect and give it the right things to do its job, it can then rejuvenate itself and take care of us. But if we don't treat it well and we don't take care of us, so, you know, it's not going to take care of us. So the way that you live your life and all of those key pieces, just what we do, just alluded to, you know, your I call it digestive health and detoxification, and the 4S is stress, sleep, social, and spiritual health. If we don't take care of our bodies, if we don't do that, it doesn't take care of us, and our immune system can actually then overreact or underreact, and then we're now sitting ducks in this hostile world.
Absolutely. And you know, you mentioned some of the chronic illnesses, and that's definitely, you know, people who are more predisposed, right, to not doing well with the COVID, with the virus, the coronavirus, all the diabetes and the heart disease and, you know, so on and so forth, but also people with autoimmune conditions. And we talked about this before, where you had Hashimoto's, mom had lupus, you know, my mother has Crohn's. We are all exposed to different things because of our body chemistry. And we really need to know that unless our immune system is taken care of, we can actually get more autoimmune conditions, and that may develop in us where perhaps we would have prevented it otherwise, right?
Absolutely.
And it
Because
just kind of creates this havoc in our body. But yeah.
No, absolutely. Because remember, there's like two different parts of the immune system. There is the innate immunity, which is like more search and destroy, which is the ancient part of our immune system. And that's like programmed in our genes.
Yes.
And it tries to basically it's non-selective. It just tries to get rid of whatever pathogen it sees.
Right.
It just tries to fix it. And then there's the other sign is basically there is the adaptive immunity, and that's recognize and remember.
Right.
So the first part is the one that's really responsible. It has this inflammatory response. It works by inflammation. Well, the other one, it just basically works mostly by antibodies. So that if an intruder comes again, then it's able to like say, hey, you shouldn't be here, and it gets rid of it. But when the first part is stuck in the on position, like what you were alluding to, if it's stuck on the on position, your body is constantly being attacked on every which way. It's in a state of like alertness.
Yes.
You can't get rid of it.
Yes.
And so it gradually destroys this magnificent masterpiece that we were born with, because the fact that now this trickles down to the chronic inflammatory, that's when you call it chronic inflammation. And that chronic inflammation is what you're talking about. It's basically can lead to all of these chronic like autoimmune conditions.
Yes.
And these eczema and ADHD and asthma and all of digestive issues. So you name it, can lead to all these chronic health.
Exactly. And we know, and we've known this in the functional medicine world, but even in traditional medicine, it's becoming sort of mainstay that almost every disease begins with inflammation, and almost every disease probably begins in the gut, right? The gut microbiome is such an important part of what's going on in our bodies, and it helps us regulate everything in our bodies. And, speaking of the feeling like you're in a fight or flight mode all the time, or in a sympathetic state, that's going to affect your cortisol levels. And when your cortisol is disrupted, and when you're in adrenal exhaustion or adrenal fatigue, you're not going to be able to defend your body, because it's really just in a survival mode, and it destroys our cells rather than regenerating our cells.
Absolutely. I love how you mentioned regenerating, because this is just, it's craziness to think that every 10 seconds we are making 1 million new white blood cells, 20 million new red blood cells, and 30 million new platelets from our bone marrow. And that's known as immunorejuvenation. So we're truly immunorejuvenating our bodies every 10 seconds. Exactly. It's regenerating the immune system. And it's so basic, and it's really crazy. It's just and our body is so great at doing that. It gets rid of all the old, naive, or adolescent cells, and then it gets replaced by these new cells.
Yes.
If we're not treating our bodies well, then you have more of these aged cells, or these zombie cells that are running around, leading to, again, chronic inflammation. And then also the way that we're treating our bodies can, over time, now you have more damaged immune cells versus the new fresh warrior cells, and can lead to something called inflammaging. And again, everything that we're talking about, and I used to deal with a lot, we all deal with now insulin resistance.
Of course.
Heart disease, hypertension, all of these inflammatory conditions are also then making that we are basically collecting these damaged immune cells. And specifically in obesity. We're collecting all of these damaged immune cells that, again, in obesity leads to, again, more of an altered immune function. Because it releases this pro-inflammatory cytokines.
Absolutely.
Basically, all of these chronic conditions can lead to premature, it's called immunosenescence, when your immune system gets old, doesn't get rid of all these bad cells, leads to inflammaging, and can have chronic health conditions.
Absolutely. You couldn't have described this better. What is going on, and just kind of reiterate what you're saying here, is that even people who have, and this is kind of scary stuff, right? In my family, we have 2 cases of this, one neurodegenerative disease, so ALS, all neurodegenerative conditions. We hear about it so much. Alzheimer's is on such a rise. So Alzheimer's, MS, Parkinson's, ALS, all the neurodegenerative conditions are now going back to us looking at everything and saying, okay, the initial insult was an inflamed body, which then relates to an inflamed gut, and then the gut-brain connection, so an inflamed brain, and then that kind of leads to a lot of these very tough conditions that none of us want in anybody we love or ourselves. And similarly with cancer, right? I mean, we know that there are things that you've got genetics, right? We alluded to genetics before. So sure, there's a genetic predisposition to things. You might think, okay, I can't control it. But 90% of what's going to happen to you is not the genetics, it's the epigenetics. It's the environment. Yes. It's the environment, it's the lifestyle, it's what you do to either turn on or turn off those genes. It's really not something you want to say, well, I have a genetic predisposition to this, so I'm going to get hypertension or heart disease or cancer or what have you. That is absolutely not true. And I think it's a wonderful feeling, because now you're back in control, right? So you don't have to release that control to your genes. You got to take control,
We're gonna control it.
Superhero control. Yeah. So
you're absolutely correct. And that gives us more power. I mean, I think specifically in the world right now where we're like hopeless, we're just sitting around like sitting ducks. No, there's so much that you can do. And genes, I mean, we have all this human genome is made up of like only 1% of that codes for genes. The rest of it is made up of these 99% of these junk DNA that we before thought didn't really do anything, but now we realize that that's where the information resides that tells the genes how they're going to be expressed. And that determines what genes are going to go on and off depending upon our lifestyle. So yes,
exactly.
I
think, and I always like to make this point for my community and for our listeners that, you are in control. Don't ever feel out of control. It is your body. You know your body best. You should be your own best advocate, and you should try and find a doctor, a physician, a functional medicine doctor who can hold your hand through it and be your advocate with you. Because unfortunately, when I was practicing traditional medicine, and same with you, Dr. Madiha, in traditional medicine, when you're accepting insurance, you simply don't have the time that I feel like it takes to take care of a person as a person, not a patient as a piece of paper and their labs, right? So for me, that's so important. And that's really been my absolute joy in practicing functional medicine, is to be able to have those relationships with my patients where I really truly understand what is going on with them, what their past is, what their stressors are, what they're eating, what they're doing, what their lifestyle is. All of that is almost equally important, if not more important, than some disease and symptomatology that they came in with.
And absolutely, because I know as a family physician, that's what we were taught. My sugar daddy / husband he has to see 110 patients a week for our paycheck not to go half.
Oh my gosh, yes.
So we're stuck on this hamster wheel, and then again, most doctors have all this debt.
Yeah.
Where we are forced to stay on this hamster wheel and not really think beyond the box. But when you start thinking beyond the box, that's when, oh my gosh.
Oh, and you never want to come back into the box. No, thank you. Close it up, put a lock on it.
Close it up, because it's so powerful. The decisions that you make every single day can not only affect your immune system, but even down to your genetic code.
Yeah.
Right?
Totally.
So that's why it's so empowering. We got this. Yay!
Go for it. So I want to shift gears a little bit and talk about your first bestseller. I'm so proud of your book. So tell us a little bit, what inspired you to write this book, and what was the book's focus? Because I've heard through the grapevine, it's actually used in a few medical schools. How wonderful.
Yes, it's exciting.
Yes, that's super exciting. So tell us about it.
Again, when I was dealing with this, when I was researching, I was dove into the research and the literature, and I'm like, it needs, specifically for a family physician, who deals with every age group and every demographic, with every chronic health condition affecting every organ, right? It all comes down, we have all of these symptoms. Where do I start, doctor?
Yes.
And for me as a fam learning, and I was learning all this holistic medicine, functional medicine. I'm also certified in homeopathy. So I was learning all of these different approaches, but then I was going from one book to another book to another book to another book. And I'm like, if I have somebody with, you know, depression and then Sjogren's and then somebody with eczema, it's like affecting every organ system. So where am I going to get someone to start with? So I wanted to create a resource that had integrative, functional, holistic medicine, all in one source, covering over 80 conditions.
Nice.
For all ages. So for each, so I start off with the foundations of good health, which are again, digestive health, detoxification, the 4S's, stress, sleep, social, and spiritual health.
Right.
And then I dove into, for example, we got eczema, and then it goes, these are the supplements, these are the homeopathics, these are the acupressure points, and these are the aromatherapy that you can use. So for over 70 to 80 conditions for all ages.
So it's so comprehensive. It's
yes.
so comprehensive, which is
and just to give somebody a place to start, because I know as a family physician, if I was confused on where I wanted my assist to start, what pieces of the puzzle that I was going to introduce into my life that are easy, fast, cost-effective, evidence-based, I needed to have it all. So I was sort of creating this resource for myself, and then it reciprocated that into a book.
Amazing.
And it's been a bestseller and doing really, really well. And just recently came out in paperback.
Awesome. So happy for you. So happy for you. I mean, I would definitely highly recommend it, because again, you know, there's so many conditions out there. And as a patient, like I was saying before, people have to be their own best advocates. And you're absolutely right. Sometimes it's difficult to find a functional medicine doctor or even afford a functional medicine doctor, or, you know, you just don't know where to start. And I would definitely recommend that, you know, much like your book goes into, take a comprehensive approach where you really are looking at decreasing inflammation, reducing the toxins in your body, reducing the toxins in your environment. And you beautifully said, I mean, I'm such a big fan of acupuncture. I mean, I had it myself for a lot of things when I was going through my cancer treatments, etc. I had it for my children, for my husband during his journey. Acupuncture is hugely important and super effective. But homeopathy and other nutritional elements, because I won't start my journey with my patients without seeing what their nutritional deficiencies are.
Absolutely.
Right? What is going on in their gut microbiome, because that is the foundation. Because we're all exposed we're all exposed to foods and chemicals in the foods. Even if we try to be organic as possible, unfortunately, that happens. So there's so much in that book, and I'm so happy that you came up with that book and wrote that book. So thank you so much for doing
Oh my gosh, it's my honor, my pleasure. And then that's when I started then implementing this in my own life. Now, how am I going to now take this down to my children? Because I have 4 boys, 12 to 5. So 12-year-old, a 9-year-old, a 7-year-old, and a 5-year-old.
Wow.
I know.
There's also a lot of testosterone around you, my friend.
There's way too much testosterone around me.
Daddy, your boys. I mean, come on.
My husband's
do you have a female pet or anything? I mean, you gotta have some female blood around you.
Well, my mother-in-law, so that's a little bit. And I'm very blessed that my parents live nearby. My sister has been a huge support. She's a pediatric ICU physician. So I have like all these people around me that a lot of love.
Yeah, awesome.
And so, but I really wanted to see how I can then translate this to a busy mama schedule.
Sure.
And so what kind of things that I talk about in my own journey and with my patients.
Yeah.
Is like, for example, the key foundational pieces. I know I start every single one of my patients on gratitude. Every one of them.
On what? Excuse me?
Gratitude.
Absolutely. So well put.
So gratitude, I found that if we can instill subconsciously, we are so negative as a society.
Yeah.
Because remember, negativity sells. So their unhappiness sells. So if I have an iPhone 5, I know it's one of ancient phones, but the only way they're going to make you want to buy another one, they're going to tell, oh, look at all these amazing things you're going to use.
Sure.
But So again, we've been instilled, like, if what, I'm only sleeping with one man, I'm missing out. I should be sleeping with so many more.
You're going there. You're going there. You are going there.
You see what I'm saying? Like, we're full of this negativity.
Yes.
That, oh my gosh, but we have not enough.
Yes.
We need to have more.
More. Everybody wants more.
More. So I have my children and my patients immediately when we wake up in the morning say 10 things that they were thankful for.
Yeah.
So again, that's when I've included that in the book. Also, that immediately when you wake up, you want to say 10 things you're thankful for. In my house, we sing a thankful song. Thank you for my eyes. Thank you for my ears. Thank you for a beautiful day to change the world. So yes.
Good.
And if somebody starts complaining in my house, I know we need to put the gratitude pill.
Yeah.
So because I really want them to instill in their subconscious to be more positive than it is to be more negative. Because remember, studies have shown that if you live a life of frustration, your heart rate variability is all over the place.
Of course.
And when you live a life of appreciation, it's now a nice sine wave, and everything works better. Your genes work better. There's lower stress. You sleep better. Everything.
And it impacts the energy field around you. And
yes.
There's a ton of studies, right? I mean, think about the studies with water, and if you just take the water and put gratitude into the water or pray over the water, the molecular structure of that H2O is totally different than if you cuss at that water. It totally changes. And so we're surrounded by this energetic field, and gratitude is a much higher energetic field than is complaining or fear or anger or sadness or depression or any of those emotions, right? So
absolutely,
couldn't agree with you more. That's how you elevate your field first thing in the morning. Boom.
First thing in the morning, especially because I mean, I wake up because I know I can wake up, and I mean, this would have been like the first year that all children will have been out of the house. So now they're all in the house.
Yes.
So now, because my youngest is in kindergarten, so I would be like, yay. So I could wake up and say, oh crap, I got to do this again. Or I can say,
I thought you guys were getting on the bus. We're so thankful we have them all still.
So thankful. So that's where it really does. Specifically with moms, we got to wake up with gratitude and focus on the pieces in our lives that are going right, then instead of those pieces that are going wrong in our lives.
Yeah.
And so I even have my patients put little sticky notes all over the house.
Yeah.
And just to remind them of all the things that they should be blessed.
I think that's a great tip. And I, definitely think that makes a huge
difference. Yeah. And
so
then we go into and then we go into the different pieces, obviously then optimizing, making sure your sleep as well, your social, your stress management,
all of that.
meditation, yoga,
definitely.
And then feeding ourselves and our families well with tons of vegetables, clean protein, healthy fats. Yes. And eating the rainbow to give our bodies the phytonutrients it needs.
Absolutely.
Flavonoids and all of these amazing nutrients that it needs to help optimize our immune system.
Definitely.
And so just to incorporate these pieces into your daily routine.
Yeah.
And that's what I've done then in the kids, because the kids can do the same thing.
Super
to incorporate and I sort of alluded to like a healing prescription, like a holistic prescription.
Yeah.
And I give like the kids a little checklist. So here's like the holistic, this is the holistic. Yeah, this is Adam. It's like Adam's healing. So it's like a holistic checklist and the things that they can do with their parents every day.
Make it very practical and easy for kids, because that's what they need.
And moms.
I'm so happy that you've done that. So definitely. I think that's a great book for kids because they need to start young. They need to start early. Mm-hmm. Speaking of children, let's talk just for a few minutes on how can we help children understand the microbiome. And then speaking on that, you've also helped your children create this podcast. So let's talk about both of those things. How exciting.
Yes, the microbiome. I mean, we started off, what every child loves to talk about one thing, poop.
Yeah. And you know what? When we're new moms, that's all we talk about too. How much did they eat? How much did they poop? How much did they eat? How much did they poop? And so they learn from us. We started
it. Yeah. So that then starts an entertaining discussion, because then it goes into that, we have bugs or friends in our bellies.
Yes.
And those friends, if we want to feed those good friends in our bellies good food to keep them healthy, would you want to feed it chemicals And that's how we started that conversation. Even with my 5-year-old, we call them friends in our bodies.
Yes.
And these friends, either we can feed it good things or we can not take care of it and it'll die and then it'll get replaced by these bad bacteria.
Right.
So just really helping them understand that the decisions that they make every day,
Yeah.
even those things that we think are just harmless are really not harmless. Giving a kid a lollipop filled with sugar and artificial chemicals can destroy and really throw off that gut microbiome.
Yes.
And it can lead to dysbiosis starting early. And now we're seeing more and more chronic health conditions, younger and younger, all showing that our gut microbiomes are truly off.
Absolutely.
Even at a younger age. Because now again, I mean, you're seeing that probably in your practice.
Absolutely. And you know what's really heartbreaking to me is you're absolutely right. It starts the earlier you can start. And as a gynecologist and as an OB, I would say you need to actually start in utero as a pregnant mother. You know, I advise all of my pregnant moms to make sure that they're eating well, they're taking digestive enzymes and probiotics and proteolytic enzymes, because those are going to pass along to their babies while they're in utero. And then when they're young, you know, they need to be continuing all of those things and really monitoring to not give the inflammatory food. What kills me, my daughter just went off to college, and what just absolutely kills me, because I see a lot of young adults in my practice as well, the food that is served in our schools and in colleges. Oh my gosh. I had to actually just yesterday, Zoe's her name, Zoe, you know, I said, okay, no more cafeteria eating, because we eat so clean in our home that now that she's at university and she's, you know, eating like every other college kid eats at the cafeteria. And though she tries to pick, you know, protein and vegetables, none of it is organic. All of it is filled with hormones. All of it is just junky.
What oils that they use.
Oh my gosh. So she started feeling horrible just as soon as she got to college, you know, whether it be migraines or fatigue or, you know, any of those things, they're all coming in. And I'm like, it totally points to the food that is going into your body.
Absolutely. And if we can teach the kids young to look at that, because I don't think we give kids enough, I don't think we give the kids enough credit. If they can figure out how to turn an iPhone on and how to do all those things at such a young age, they can figure out what they're going to put on in their bodies.
Absolutely.
And do the best you possibly can. Right now, obviously, like kids are a little bit younger, so it's a little, and now they're home, so it's a little bit easier.
But information is everything.
Education is everything.
Yeah, absolutely. And, you know, the thing about it is, you know, one of these days we'll have to talk again about what we need to do with the food that is being served in schools and universities, because, I mean, she had to go to Whole Foods and get her stuff, and that's what she's going to eat. She made a decision that it's not okay for her to feel like that.
And absolutely.
So just because you're in college doesn't mean you have to indulge in those things. You do have choices. It's harder.
But you are such an amazing mama. Because of the fact that she recognized that stuff, that she recognized that her body was off balance. And that's literally what I'm doing with my own children also, is that if they feel that something is off balance, it's so funny. The other day, my 9-year-old, I went into in the morning time, he's like, no, I'm like, do you want breakfast? He goes, no, Mama, I got an intermittent fast today. I'm like, okay, why do you have to intermittent fast?
I love it.
And he goes, oh no, Mama, my body was just feeling a little awful, agitated. I want my insulin to be a little bit elevated.
Love it.
I'm trying to bring that down a little bit. And then for lunch, and I'm like, so what do you want for lunch? He goes, just a bowl of sauerkraut, Mom. Just a bowl. It'll help me.
I love it. I love it. This is a great interaction. Great interaction. Oh my God.
Listen to their bodies. And
they do.
Their lifestyles, just like what you did.
Yes.
Right?
Well, they also feel better. They also feel better, right? They feel better when they make the right choices. It's funny because my son Zaid, he's now, believe it or not, next week he's going to be 17. I can't believe it. But I know. He was only 13 when my husband got diagnosed with ALS. And, you know, we took our journey with ALS from a very functional medicine approach. So the first thing we dove into is nutrition and diet and decreasing inflammation and all of that. And if you would believe this, everything on our ALS Heroes, which is our family foundation for ALS to try to help find a cure, everything on the ALS Heroes platform that is related to food, nutrition, recipes, whether it's for tube feeds or shakes or what have you, they're all done by Zaid when he was 14. And then they're just,
Wow,
I'm not kidding.
empowering.
He's like major
Beautiful.
into nutrition, food, healthy eating, lifestyle, etc. And I'm just thinking, when you think about tragedies transforming lives, right? I mean,
And
it's
families.
so difficult, but it transforms lives and makes the people who they are. Like today, it's funny, whenever I'm about to put something in my mouth, I was about to go for a run this morning. And I was like, Zaid, what do you think I should, eat before I go for a run? He goes, fasting cardio, mommy. Fasting cardio is the way to go. And I'm like, okay, so just my herbal tea then? And he goes, yep.
Yeah, that's it.
When you come back. And I mean, I like actually listen to him. It's great because
No, it's amazing.
Like,
and I know that too, because like, I usually go for like 24-hour fasts on a daily basis.
Yes.
But my kids know that about me, and then they see that. And I think that's what's awesome is that now we're a conversation. Now you can have like a family and you guys are both in it to win it together.
Exactly.
And specifically when this all started, this COVID and now the quarantine, and now I'm like, okay, what am I going to do with these kids? Right? But just like what you're doing, you're putting them, now your kids are working on creating these recipes and now have a higher mission in life.
Yeah.
I'm like, you guys know way too much information where, insulin resistance and gut microbiome and
that's awesome.
glutathione and all these things are in our normal vocabulary. And, glyphosate, these are in our normal vocabulary. So I'm like, let's go ahead. You guys just give me like an hour a month. Let's start off with an hour a month, just new guests. It is a hit. It is so hot. So we call it the Feisty Kids Show.
Oh, that's awesome. That's amazing. I love it.
That's awesome.
Do they love doing it?
Exciting.
Do they love doing it?
They love doing it because they love having conversations.
Good.
Things that they know. I love it because the fact that somebody else can tell them what to do, not just me.
Yes.
So it's really empowered them, during lunchtime. So we do that after school, and then during lunchtime while they're with me, and then we do meditation, and we just incorporate all of these different pieces into their daily routine. But really, again, empowering the next generation is my mission and my passion. And that's when I started also the Family Health Expo that occurs yearly. Right now, it was supposed to be September 12th, but then this has shifted me a couple months the next time. But it's been such a blessing and a journey to really help empower this future generation, because we have to. There's enough adults talking to adults. Now we got to start incorporating the kids.
Well, they are our future. They really are. I mean, this world, unfortunately, somehow we have not respected Mother Earth over the last century or so, and it's up to our future generations to bring it all back in, and do things for themselves and for others, and they're so much more socially responsible than perhaps, our generation or previous generations. And I'm so proud of the future generation. They're great souls that are going to bring this Mother Earth back to where it needs to be. With that, I just want to thank you. Oh my gosh.
So much fun. Thank you.
Maybe we could just keep talking and talking and talking, but we'll have to do this again. And congratulations on your books.
Thank you.
To announce that, yes, love it. And I'd highly recommend everyone to get a copy, because it's an amazing book. And I can't wait to listen to the kiddos podcast. Tell me the name of the podcast again.
It's called The Holistic Kids Show.
I love it.
I know. Next week is Dr. Terry Walls.
No way.
I know. She was so adorable. She has been nothing but love. I know. So, and all these amazing guests that have been on there, and they literally, I'm in the background, so they don't even see me on this podcast or hear me, or my voice is nowhere. They take charge of the questions. They take charge of the conversation. Nice. And so literally these guests are talking to a 12-year-old and a 9-year-old.
Wow. I love it. I can't wait to go get that and watch it right after this. So thank you for joining me. It was such a pleasure and such an honor to talk to you. And you were just amazing. And best of luck with all of your missions. Lots and lots of love You take care. Keep doing the amazing work.
Thank you so
And
much.
yeah, have an awesome day. Bye. Thank you, everybody, for joining us today. And we will get with you hopefully next week with our next guest. Thank you again for joining us, Dr. Leah. Thank you so much for making time for today's podcast with Get Well with Dr. Shel. I know that this conversation and education can help you to create your best life possible on every level. So definitely tune in to hear the newest expert and learn the latest protocols to support your best health journey. You can learn more about me and my wellness center at drshel.com, drshel.com, and I hope that you will make time to come visit us in the Houston area to take a deep dive on self-care. My team and I are completely devoted to helping you live a better life from this moment forward. The best days of your life are ahead of you, I promise. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin.